Thanks very much. It's great to be back in Australia. My first time here in like 8 years. My favorite piece of old school technology, my R.M. Williams boots. So I'm going to go back and get a new pair. These are really old, but I love them. So I'm going to try and take you on a quick guide of where technology is taking us across the spectrum. And as you've been hearing, from digital quantum computing to AI, it's a fascinating, fast-moving age that has the potential to really shape and reshape healthcare here in Australia and around the world, from wellness and prevention, keeping ourselves healthy, to a better job of early, smarter diagnostics, to more personalized therapies, to discovery, to global health. So it's a really amazing time, but I don't know about you, but when you go and visit the doctor, sometimes maybe it doesn't feel like you're still stuck back in the future. Remember Back to the Future movie? I'm still waiting for my hoverboard, though as of last week, you can get the self-lacing shoes. So sometimes the future's still stuck in the past. And I trained at Stanford for medical school. I went to Mass General for my residency training, and I visited there recently. I had a reunion of the house staff I trained with. And if you visit Mass General, you can visit a famous spot of healthcare history where back in 1846, the first general anesthesia was done. That's called the Ether Dome. Hasn't changed in 160 plus years. But I was a little shocked and dismayed to visit the ward where I spent my first month as a brand new doctor 20 years ago. Do you see, that was completely also frozen in time and unchanged in over 20 years. Same alarms were beeping, some of the same nurses, some of the same patients. The only difference was the poor young intern, the new doctor on call, was having to type out the medical record, put in the paper chart, and the front desk is using the cutting edge medical communication tool of our day, the fax machine. And so whether you're at Mass General or any of the great institutions here in Australia and beyond, I think sometimes we're still stuck in the past, defining health and medicine in old silos and old mindsets. But we're now in this exponential age, this connected age, this quantum age. We can now rethink health and medicine outside of the bucket of body parts and subspecialties as we move forward into the fast-paced future. And potentially redefine how we operate, because we're really much more in a sick care system than a healthcare system. What do I mean by sick care? Well, today the data we get is very intermittent. An occasional blood pressure check, EKG, you're filling out the same form for the 20th time. You may be faxing or PDFing your blood sugars or blood pressure. So we have broken feedback loops that are intermittent. And therefore we're quite reactive. We wait for the heart attack or the stroke or the lump to be discovered at stage 3 and stage 4. I'm an oncologist. I'm tired of patients presenting late. What if we could pick up stage 0 cancers? So with some of these new technologies coming together, we have the opportunity to be much more continuous and much more proactive as we move forward into a true area of healthcare. And rethink the model of waiting an hour on the doctor's visit for that 12-minute visit, whether you're here in Melbourne or in Calcutta, and shift where and how healthcare happens. Because time and these technologies coming together and converging give us an opportunity to do that. Now, of course, technology is only a piece of that. We need to align the incentives, many misaligned incentives. We need to align the policies, how we pay for medicine, how we reward things. And those things are starting to shift as well. In the United States and many parts of here in Australia, we get paid to do more procedures, more biopsies, more transplants. So it's not always evidence-based medicine, it's reimbursement-based medicine, where we spend 80% of our dollar on those who already have disease. But we're starting to shift those incentives to value-based care, to rewarding better drugs that work, or for keeping people out of the hospital as opposed to bringing them in. So the incentives are aligning with the technology. And so that enables where healthcare happens to shift as well. It usually happens in the four walls of the emergency room, the clinic, the intensive care unit, but technology is increasingly bringing healthcare from our hospital to our home, to our phone, to into and inside our own bodies. So that's creating a tremendous disruption. Sometimes your corner pharmacy wants to be your primary care center, not your hospital or your clinic. Now, one other element layering on this, of course, now you can be much more empowered as an individual to own your healthcare data, to enter clinical trials, to be a data donor. So instead of going to the doctor and them telling you what to do, you can be, if not the CEO of your health, at least the COO. And where there's more transparency now as a consumer, you can compare one hospital to another, the outcomes of one surgeon, the prices of a drug. So that Yelp model for healthcare is coming. Now, of course, a lot of this is being enabled by these fast-moving technologies. A smartphone in our pockets have 1 billion times the price and power of a supercomputer from the 1970s, writing Moore's Law, and these are becoming healthcare devices, right? And I found my iPhone 1 the other day, only 8 years old. It felt slow and clunky. At the time, it felt magical. This is the iPhone 7. It'll soon look antique. I was actually visiting Apple headquarters down the street from me a couple weeks ago. I had a sneak peek, don't tell anyone, at the Apple iPhone 10. And here's the iPhone 11. So those are coming fast and furious. But seriously, imagine the technologies and the abilities of the iPhone 12, how that could be used in health and medicine. And of course, as we've just heard, these are writing Moore's Law, the power of computing. And it's not just Moore's Law that's speeding up, it's many technologies. And you all now, especially after the day here, need to become exponential thinkers. Look at where the puck is going, and look at those opportunity spaces, because that's where the opportunity to disrupt occurs, not to be the disruptee. So now with Moore's Law, we have the desktop from the fitting on our smartphone, now fitting on my Apple Watch. They're now computers the size of a grain of rice that are, of course, all becoming connected. You've heard of the Internet of Internet of Things. That's coming to the Internet of medical things and health things. And it's disappearing whole objects. You no longer buy $100,000 worth of technologies. Those are becoming appified, which is disruptive to if you're making a GPS device or a video camera. So where does this take healthcare? The bridging together of all these new elements is often called digital health or connected health or mobile health. I think soon we'll just call it health. We don't call it digital banking or digital movies. But it does give us a bit of a code word for rethinking and reimagining healthcare and bringing many of these technologies together. Because it's not just Moore's Law and quantum computing and AI, it's the blending of 3D printing and drones and sensors and low-cost genomics coming together that's enabling us to rethink healthcare and address the grand challenges we have around the planet, whether it's the rising costs, the aging populations, access to care. I almost did the Royal Flying Doctors Medical Service, but I couldn't medical school. You will have remote areas here in Australia. How to bring care to them? How do you leverage the exponential data sets and make it useful information? All the fragmented care, faxing data, paper records, electronic records, and how do we help our friends, the regulators in the US, the FDA, the F word we call them, think faster, more exponentially, and how do we help the payers, the insurance companies, to reward some of these new technologies? So reimagination is all around us. You all know the example of Uber. Uber is an exponential company. They couldn't have existed 10 years ago. They didn't invent the smartphone, online maps, GPS, but they've disrupted the travel world using these technologies. And I was actually in Menlo Park the other day. I was behind one of the new self-driving Google cars with no steering wheel. I was very excited to be behind it until I realized it was going exactly the speed limit. I was like, oh, great. But even they are doing self-driving Ubers in Pittsburgh. And are using Ubers to pick up and deliver passengers. And now you're seeing the idea of Uber Health. To press a button on your smartphone, a nurse comes to you, give you a flu vaccine. Or bringing back the house call. Press a button on the app and a doctor or medic or nurse comes to you within a couple hours. Not sure what kind of doctor or nurse you get, but you get one. And they can rate you and you can rate them, so the transparency elements are there. So all these things are coming, and they're disruptive to friends in pharma, medical device, insurance. Our trick is to be the disruptor, not the disruptee. Now, I get an interesting vantage point on this. I chair medicine at Singularity University. You had Peter Diamandis, one of the co-founders, here last year, and the other co-founder, Ray Kurzweil, here at this conference 3 or 4 years ago. And I chair medicine, or Mesnam is here. You'll hear from him, which chairs energy. We talk about AI, robotics, 3D printing, and beyond, and ask, how do we understand these technologies and leverage them to impact global challenges around the world? And many of the new folks who come to Singularity University aren't medics or docs or biotech folks, but they've applied their skills and mindsets to rethink not just energy and environment, but also healthcare. So about half of the new companies and startups are focused in healthcare. And because medicine is a multidisciplinary sport, I founded a program 5 years ago called Exponential Medicine, bringing together folks from across the spectrum, not just medics and docs and nurses, but to rethink medicine from across the equation. We just had our 5th conference. Here's our group by drone this year. That used to be $1 million. You couldn't have bought a drone for $1 million like that 5 years ago. Now they're basically $50 or less. And in fact, drones themselves from one of our SU companies are now being used to deliver drugs and vaccines and blood products. They just partnered with Daimler Chrysler. We're seeing drones being delivered to deliver defibrillators or organ products. There's even a group in San Francisco who wants to use them to deliver drugs. I'm not sure what kind of drugs in San Francisco. But those things are coming fast and furious. So let's look quickly at a few areas and how they're shifting and how you can play a role. First of all, health and prevention. Most important element is we can pay attention to prevention. Our genetics, of course, are important, but our behaviors are much more impactful downstream. And now we're in an era where you can measure our behaviors. I'm wearing 4 different Fitbits and things on my wrist today. Many of you might have one or have it in your drawer. But when you can measure your bad behaviors and optimize and tune them, you can prevent many of the long-term chronic diseases and costs. And now with these technologies that are essentially almost free and embedded into our environments, we can start to do that. And these, of course, are moving from quantified self, the data geeks who want to track their steps and their sleep and all the elements, to quantified health, where you might see health systems here, like the NHS, start to prescribe a wearable device to track your sleep, your blood sugar, your weight, and integrate that data with your medical record. And the sensors are getting much more complex, not just tracking your steps and your sleep, but RFIDs in a pill that can tell when you took the pill, track your swimming, track your tennis serve. There are now the idea from wearables to insidables, contact lenses made by Google and with pharma to track blood sugar. So that's an idea of a wearable or an insidable. We're moving from insidables to trainables, something in our smartphone era, like our posture isn't so good. So this is a little sensor you can put on your back and it buzzes your back when you're hunched over for too long. And after about a week of wearing this, your posture's improved. Could help lower back pain. Shockables, Pavlov might need to help you out. That'll change behavior. Ringables that can track your sleep, a sleep lab on your finger. Sleep, so important to chronic and long-term health. You can track that today. Hearables, not just for music, but your heart rate and your steps, and eventually AI in your ear. So all these things are coming fast and furious, embedding in our clothes to help you with a triathlon, but if you're a heart failure patient or have emphysema, or have a pregnancy to track the health of the fetus. And when that bundle of joys arrived, maybe you can track them in new ways. This used to be artifacts from the future, but no kidding, Huggies last year came out with Tweet Pee. You can figure out what that one does. There's data for number 2 as well. And I'm a pediatrician. This could be useful to send a kid home with a connected teddy bear or onesie to track their health and data from the home. The trick is, what do we do with this information? If it's a connected binky or how much milk they're drinking, when does it become overwhelming? We can now track our breath. If our blood alcohol level is too high, this device can lock you out of your car and call you an Uber. It can also soon start to layer and measure molecules from your breath that might pick up lung cancer or other diseases. Now, though the problem is we don't want to wear 20 devices or have 50 apps on our phone. We need to see these integrating. And big companies, Samsung, Apple, Google, Facebook are starting to get into the space. Like the Apple or the Apple Watch 2 isn't terrific yet, but it's only the version 2. And Apple's admitted they're going into healthcare. So an apple a day keeps the doctor away, may have new meanings. And these can incentivize us as individuals to take those 10,000 steps and other healthy elements and even be rewarded for doing that, which is going to open up whole other industries as we move downstream. So new business, new jobs. Our smart homes now, the Wi-Fi in the room can connect and pick up the vital signs of up to 10 people at the same time. So we're entering this age, whether we like it or not, where we're always going to be connected with our digital health exhaust. The trick is, what do we do with that information? One application is our mental health. Mental health crosses so many different elements of health and medicine. We've gotten better at stroke and HIV and heart disease, but suicide and other elements is still a big problem. Now, our smartphones can pick up our emotional states. This is an app we can try called Moody's. It can measure your emotions and your stress through your voice. Or we're seeing apps like Ginger.io that are a marker for if someone's depressed or manic, your phone can tell. So we can start to appify and bring help to folks when they need it. And give yourself digital hugs and call your help team. Our smartphones are starting to connect the dots because, again, you don't want to log in. Your doctor certainly doesn't want to log into 10 different applications. Now, at Stanford, I can take my health kit data through my phone and log it into my medical record, and my physician can see it. Very early days of doing that, but again, the feedback loops are starting to be connected. So what if your doctor and yourself could see not just your steps and your sleep and your weight, but the integration of lots of this information, like a financial health score, a health score for your health and wellness, from your vitals to your sexual health, your connected health, your financial health, all come together to provide information and hopefully can enable us to be proactive. I like to call it predictive analytics. Before you drive your car off a cliff, it can give you an early warning. So just like our modern cars, which have 300 or 400 sensors, we might have our own individual check engine lights. When that check engine light goes on, time to go see the doctor. And it won't be the devices that are valuable, it's the data architecture on top, these OnStar systems for the body that can be a bit of a virtual GPS. Daniel, go right to the gym or the yoga class, not left at the fast food restaurant. Or how to manage my chronic disease. All these things are going to come through these connected smart systems and update. Just like Tesla, they're basically self-driving today, they have a hive mind. You can update them through the cloud, they communicate to each other, they can inform the maps, so they go from normal maps to high precision maps. I wonder if we could crowdsource and share healthcare systems and data across the world. Now, just having the data is not enough. The data can be overwhelming. We know behavior change is hard, so we need coaches to help us do this. There's virtual coaches and digital coaches you can reach with your smartphone and have chats with them. There are now AI versions of coaches, like this app called Lark you can all try. It's a little chat bot that tracks your health and wellness and diet. Soon these will manage chronic and advanced diseases and remind me right now that I'm jet lagged, I should get some extra sleep, for example. We're seeing robotics. We'll hear more about robotics come into the home to help interface and help you remind you to take your medicines. Some of you may have an Amazon Echo. These are early versions, essentially, of connected AI chatbots in your kitchen. Echo, play me some music, call the Beatles, call an Uber, what's the weather? So these are going to become healthcare platforms where they can tell you how much meds to take, or if you fall down, to help you call for help. The connected smart home is essentially already here. And those connected homes will be visible in our smart mirrors. The coaches will show you the you of today, that might also show you the you of tomorrow when you look in the mirror. What if you saw you of tomorrow, right? That might change your perception if you're really working out, you're really doing your exercise every morning, you of tomorrow. Or if you keep having pastries for breakfast, you of tomorrow. That's a different perception. Here's me now, here's me 1,000 donuts later. I might pause before I have the extra donut. Or if someone who smokes, if you can show them before smoking with their face and after smoking, that can be a powerful lever. Or if you or your kids are spending too much time on Facebook, what happens? Another story. But this is an example of other technologies coming to healthcare. Augmented reality, a supercomputer on your face. That's incredible. It can enable surgeons to see more data. It can help autistic kids understand emotional states. We're seeing these devices go into big Hololens from Microsoft, which are now being used to train medical students for, can I go back a slide, for education. We're enabling surgeons now to layer MRI or CT scan data on top of a patient to do smarter, less invasive procedures. So again, the blending of data and augmented and virtual reality has tremendous applications and is a convergence of exponential technologies coming to the clinic and coming to help you as well. Here's the video of the animation of these HoloLenses for teaching anatomy, so we can democratize healthcare with these sorts of tools. We're moving quickly to an era where we're going to probably be throwing away our computers. This is the Meta headset. You can interact with devices, multiple screens. I argue in 5 years we won't have screens, we'll have these sort of headsets and have multiple screens all around us that will integrate. So this has implications across many fields, of course. Virtual reality. Who's tried virtual reality? Okay, some of you haven't. That's an expensive version. You get a cheap $2 cardboard. Put your smartphone in there. Go ride a roller coaster. Or use it as a therapeutic now to treat folks who have pain issues. Or there's now simulators now for surgeons now where they can literally go in these environments and learn to train with the right instruments and get feedback and do less medical errors. We've seen the first real-time VR surgeries. I was in London 6 months ago. The first time they live streamed through VR a surgery to 5,000 people. So we can translate and change how we do medical education. Or exercise with things like Pokemon Go. I got to level 8 before I gave up, right? Other technologies can help health and wellness that are exponential. Meditation and yoga are old technologies, but we can just start to look at their effects on our brain with off-the-shelf brain-computer interfaces that you can wear. I could prescribe you mindfulness and meditation instead of a drug. We can use these to treat kids who have attention deficit disorder. We're seeing these play a role now in advanced forms. You can apply energy to the brain, which might help our thinking in some cases. So hacking our brain with little devices like this one called the Think. And we can even use video games now to optimize normal and to optimize brain performance. So video gaming is becoming prescribable and even paid for. Don't press the button, but move your body. How about our genomes? We're now in the exponential age of lower-cost genomics. It's dropped from $1 million a genome to about a $1,000 genome today. You can use your genome to predict face, height, weight. This is something that's going to literally be part of our medical record in a few years at $100 or less. I just got my $1,000 genome. It comes with an app to help me analyze it. We can analyze the genomes and apply machine learning for diabetics and find that there are at least 3 distinct subtypes of type 2 diabetics. Every disease is going to get separated. There are app stores for genomes, which are being developed and just launched. This one out of Illumina. So I can take my 23andMe data, upload it to the cloud, and you can see here my athletic genes. True enough, I'm pretty fast, metabolic efficiency is high, 77. Not good at cross country, endurance training's not great. And I wanted to get up this morning and do my workup up at the gym, but I had trouble getting out of bed. But I have an excuse. As you see on the left, my motivation genes are low. So thanks, Mom. So it's well beyond the genome. We're now in the proteome, thousands of biomarkers from our blood, our exposome, where you've lived. The microbiome, the bugs in and on our body and inside our gut, have a tremendous role in obesity and inflammatory bowel disease. We're learning to do fecal transplants to cure people who have GI infections. You can get your own microbiome done for less than $100 and crowdsource that data. How about diagnosis? We want to pick up disease early rather than late. And sticking with these new tools, we can do that in remote locations. We're in the era of a digital doctor's bag, whether it's a connected scale, a blood pressure cuff, or an otoscope that you can send home with your kids with an ear infection, or the stethoscope of today can now be digitized. I put an attachment on it. The app itself can listen to the heart sounds and do a better job than I can. But we're throwing those away because there's now $1,000 ultrasounds you can connect your smartphone or tablet and use those with AI to do a better job than a usual radiologist, and use those again to democratize healthcare. So these technologies are dissolving. You don't need to see a dermatologist anymore. You can take a picture and the AI machine learning can say, is that a melanoma or a mole? So it's disruptive to our friends in dermatology when the AI machine can do that itself. The eye doctor can get replaced with attachments that go right on the smartphone and do that eye exam, not just for your glasses, but for the back of the eye. Or for the world of cardiology, one of the #1 killers, you can have a little smartphone case that goes in the back of your phone and determine your EKG and send that anywhere in the world to your doctor, to the CDC, to the NSA, whoever else wants the information. It's all available. And I'm actually wearing an advanced version. I'm wearing a patch right now. It's hard to do a live demo, but I'm wearing this patch under my shirt, and it's actually live streaming my EKG and other data right there. Hopefully you'll see. That's my EKG in real time on my phone. I can also look at my heart rate, my steps, my stress level, only 99%. Thanks, guys. But that's an intensive care unit level of data on your smart patch. How are we going to leverage that? How do we keep it private? What do we do with that information as we go forward? And if you do pick up heart disease, you can now do a virtual angiogram, send that data to the cloud, which can now analyze without the needle up the groin how narrow your blood vessels are. Do you need a bypass? Do you need a stent? If so, what kind of stent? Maybe we'll 3D print the stent to match your own particular anatomy. So that is already FDA and CE marked, and it's disruptive to our friends in cardiology. Let's look very briefly at how we can pull these things together. Incentive prizes, the X Prize. I've been involved in designing a medical tricorder X Prize. 400 teams entered a competition to make a real-life medical tricorder. I'm holding one right here called the Scanner Scout. When you hold it to your forehead, it pulls down your temperature, your heart rate, your O2 sat, your blood pressure, talks to your smartphone that has IBM Watson in it. These are going to enable you as a consumer to do a smarter job and a lower cost job of triage, or even doing something as simple as urinalysis. Dip the urine in and use the app and the camera to do the diagnostics and send that data forward. So lots of potential there. The lab on a chip, whether it's for Zika virus or Ebola virus, all can be printed. We now have sort of microcomputers on a chip that you can put the lab data in. All these things are coming at an exponential rate and can be applied. Now, we heard a little bit about AI, machine learning. I think that's particularly applicable in healthcare, not just artificial intelligence, but intelligence augmentation to help all the elements of keeping us healthy, diagnostics, and therapy. And of course, none of this replaces the doctor-patient relationship, but can augment it. I'm going to go 1 minute over here. To talk about therapy. Therapy, we want more personalized, tuned, less invasive therapies, to electroceuticals, little pills you can swallow as opposed to an endoscope. Electroceuticals that not just help your heart, but your brain and your gut. Maybe even remote-controlled contraceptives, which leads to issues. You know, honey, where's the remote? Or what if someone hacks the remote or hacks your pacemaker? Who owns the data from these devices? We're starting to hear prescribing apps for pregnancy or for pre-op care, and we're keeping people out of the hospital using smart data. We're seeing apps that help diabetic patients lower their blood sugar. And all these devices, again, are getting smaller, more available, and more connected and layered. So we're entering an era of therapy where the digital checkup can happen from almost anywhere at any time. And the virtual visit, the televisit, is already here. Soon it won't just be any doctor. It might be your doctor using these systems. So last year, 2015, you can't list your iPhone as your primary care doctor. We're now in 2016. I can't be your doctor if you don't download my iPhone app. So, last section, robotics. Robotics, we'll hear more about here, but it's playing a role from enabling the disabled. That one's wearing an exoskeleton, enables her to walk. Parts of that are 3D printed. 3D printing is coming fast and furious to replace the old-fashioned casts or to print a knee or hip implant to match your own anatomy. You can even print your own tumor, as my friend Stephen Keating did, to help his surgeons take it out. You can print yourself, which might be useful for issues, or 3D print a medical device, as one of our companies has done on the space station, hard-to-access elements. Here's Mini-Me. I printed myself, but I could use a 3D printed prosthetic to help a patient who's lost part of their face from lung cancer. Last 2 points. These technologies are amazing. They don't need to help make healthcare more expensive. They can democratize it. The bottom billion on the planet all have SMS phones. Soon they're going to have smartphones and supercomputers better than ones we have today. And and the 3 billion new people coming online with internet access is going to change everything because information is power. So a nurse in a rural village in Tanzania can have as much medical access as someone here in Melbourne or Sydney. So this all enables us to be participants in the future of healthcare discovery. Clinical trials don't need to take 10 years and $10 billion. You can now download an app, share your data, integrate on ResearchKit, for example, an app for Parkinson's or asthma or autism, and share that information and crowdsource it. Just like when you drive with Google Maps or Waze, you share data. Here we can build a map of Rome in a day. You would imagine driving without that information and sharing how to get around the traffic. That same mindset can come to health and medicine around the planet. So I encourage us all to think about being crowdsourced data donors, not just organ and blood donors, but data donors as well. And if we have that mindset, we can think exponentially, realizing that the puck is here in 2016, but you need to think about where the puck is going to be in 2018 and 2020, and not just exponentially, but the overlap and convergence of all these technologies from AI, robotics, and 3D printing, and drones and beyond to reimagine healthcare. No matter what your field you're in, you can apply your lessons, your technologies, your passions to help reinvent the future and move us from this era of sick care, intermittent and episodic and reactive, to a true era of healthcare, continuous, proactive, and participatory, and realize that often the future's already here. It's just not evenly distributed. Some of it's in my pockets. And it's up to all of us not to predict the future, but go out there and boldly create it together. So with that, I'll say thanks.